tying knots and quality of knots is probably one of the most essential part of the surgical procedure, which adds to saving time, adds to less morbidity, less post-op bleeding, and more secure knots, so the pedicle will not get loosen up after the procedure. Basically, you have a so-called a flat knot, which is, I'm going to go very slow here, flat knot, which is also called a safe knot. It's just like this. But a knot which is like this, it's not considered to be safe, because it's going to be the knot security is bad, and as soon as you let it go, it's going to slip and loosen up. So for us to be able to make fast and secure knot, the first principle in surgery, in my opinion, is that when a surgeon drives his or her needle holder through the tissue, the needle holder should never be dropped on the field with the needle, and should always be kept in your hand while you're tying the knot. So this is your needle holder, and what you do once the needle holder is driven through, then the essential part of it is that you will be able to tie the knot with one hand. The right hand people will be able to tie most of the time with their left hands, and the left-handed people will be able to do their hand tying mostly with the right hands. And there are basically two kinds of one hand knot tying, which is very essential, very easy to learn, very fast and very adequate and very efficient. One is called a supination knot, or three fingers tying knot, which the hand is in the position of supination like this, and the end of your suture, which is held, is always the tip of it held between your thumb and your index finger, and the end of your suture toward your needle driver comes out of your little fingers, your pinky, and then this suture line comes in between the middle finger and the thumb, not thumb, and the index finger, and then your middle finger comes over and picks this up, and it becomes a knot. Okay, this is called supination. We're going to go very slow again. Supination knot is the one that it's a hand is in the position of supination, that the end of your suture is held by your thumb and your index finger, and then the other side of the suture would goes toward the needle holder, it comes out of your little finger, and then this line crosses between the middle finger and the index finger, and the middle finger is bended and it's held, and that's a knot. Okay. The fact is, when you have your needle holder still in your hand, sometimes it's too long, so it makes it very cumbersome to tie a knot at the end of it when the suture is very long. So what you need to do, you can always shorten this up by holding the suture with your needle holder here. See, it's all shortened, and then you can do your three-finger knot or your called supination knot. Okay. Now the other knot that it is also very efficient, very easy to do, is called pronation knot. On pronation knot, your hand is in the pronation position, and the end of your suture line is held between the thumb and the middle finger, and the end of your suture comes off your index finger, almost opposite to the supination knot. Once you do this, then you create a space. The more space that you create between your holding the end of the knot and your index finger, the easier it is to throw your knot. So this line comes in between the middle finger and thumb, which holds the end of the suture, and your index finger like this, and then your index finger is going to turn around and get this knot and make a knot, which is always a flat knot. Look, this is always a flat knot. We're going to go very slow again. So we're going to make this, holding with the thumb and the index finger, and also the thumb and the middle finger, and then the end of the suture comes off the index finger, and then this line crosses here, and then very slowly I'm going to try, and then it just brings this and it makes a knot for you. Okay, then here's what is very important, that what do we do to make sure that these knots that it's tied by one hand, all flat and safe knots. There are two rules you have to follow here. I'm going to let this needle holder go and just hold this like you have a free line on both sides, and you want to tie a knot. For you to make sure that this becomes a flat knot or a secure knot, if you do a pronation knot, the pronation knot should cross over this line that it goes to your needle. See, cross over. Once it crosses over, then you make your knot. It's always a flat knot, look. So what happens, and then on the supination knot, it's the opposite. If you want to tie a supination knot, you grab this from under so it crosses under this line that it goes to the needle. And then your hand is turned around as a supination knot. And then when you tie this, it becomes a flat knot. So let's see, we have our needle holder here, okay? Back. We have our needle holder, and it's always driven. Now, very soon it becomes a reflex that you don't even have to think about it. As soon as you drive your needle, if you want to do a supination knot, you just reach under this line and grab this. Under this line and grab this. And then throw a knot, and it's a flat knot. Okay, in the meantime, if you decided that, no, I want to put a pronation knot, you reach over and grab this, and then throw a knot, and it becomes a safe knot or a flat knot. Look what happens if you don't cross this. If you don't cross this.